and engaging around issues of ethics in research. And it's been a very interesting journey to engage with this article, firstly as a researcher, but also as an ethics chair. So approaching it from different angles. As usual, this is a very informal space, so please feel free to put up your hand if you're online, or just chip in with a comment, or put something in the chat if you would like to engage with the topic. So today's article is from a journal called the Qualitative Report, and the title is Practicing Ethics and Ethics Praxis, from two colleagues in New Zealand and Australia. So it's a 2020 article, but I actually, what sparked this article was looking for something to help with a discussion that Siobhan and I had, bless you, around what do you do when you end up in a scenario in an interview where you are pushing, you feel like you're pushing a participant further than what they're able to actually engage with. And is that a problem? And at what point does one stop doing that? And where does the boundary lie in terms of ethics? And then I stumbled across this article, which seemed like a good one to end off the year. So this article by Tolich and Tumilty talk about another article, which I'm going to reference as well, to just mute the speakers as well. Thanks. Yeah.
I was speaking to that nothing.
No worries. So Gilliman and Gillam had written an article in 2004 on ethics, reflexivity, and ethically important moments in research. So I'm going to be referencing this article as well as I talk, because it seems really key. So they start with a little scenario, which I'll take us through. So picture this scene. You're a researcher working on a study examining women's experiences of heart disease. You're interviewing Sonia, a woman in her late 40s with diagnosed heart disease. Sonia lives on a remote farming property in a rural region. She's married and has one teenage daughter living at home with herself and her husband. The interview is progressing well. Over a cup of tea, you inquire about the impact of heart disease on her life. Sonia stops and closes her eyes. After a few moments' silence, you notice tears welling up. Sonia tells you that she's not coping, not because of the heart disease, but because she's just found out that her husband has been sexually abusing her daughter since she was a child. So these moments, I think we can all relate as qualitative researchers, where you're headed down one path and then all of a sudden all sorts of other things come up that you didn't expect. And then you think, okay, what now? How do I cope with that? Megan, I can see you chuckling.
Because that's the amount of times that happens in research and clinical interactions. And
absolutely,
you're not trained to deal with that periphery stuff and what do you do now?
Yes, and you can't just put it in a box and say, okay, we're not talking about that today. Yeah. So you have to actually engage with it. Joe, I'm also thinking of some of your data in Mpumalanga and some of the things that came out that were totally not what you thought that you were going to ask about. Yeah.
But supervising students, I've seen students say we're not talking about that. Really? Yeah. I think when something comes up that's so unexpected that they don't know how to deal with.
Mm-hmm.
So it's from nerves. From nerves. I've seen it doing
inexperience
interviews. And I suppose mostly in clinics, but I've seen it once or twice in a transcript that a student's going to it. Oh dear.
Yeah, so I guess it does partly come from inexperience as well. Of probably they're thinking in their head, this isn't the plan. This isn't what I'm supposed to ask. So I can't go down that road. And also, how do I go down that road?
When they're so stuck to like an interview, like interview questions or interview guide, and like.
Yes, I have to think.
Or they jumped ahead to a question that they haven't yet asked.
Yeah, we're not there yet.
Yes, exactly. You're not allowed to ask that yet. So
I'll think about that later.
So I think we all do identify very strongly with these challenging moments, and this talk today is really, and the articles are really about what do you do in those moments when things end up going on a different path. So the article talks about this concept of praxis, which is the exercise or practice of an art or skill. And they talk about how formal ethics review is really one stop along the way. So that's almost the start, where you've sat, you've designed your project, you've thought about what might happen. But actually, when you get into it, you're establishing relationships, you're designing, and then you're disseminating, but you're also just collecting data. So there's so many points along the way at which things can kind of go a different direction or pop up in a way that you didn't expect. And it really requires a lot of thoughtful action, thoughtful planning, as best as you can. Obviously, sometimes you can't plan for things like Sonia in an interview on heart disease suddenly telling you about sexual abuse. It's completely left field, not what you would expect. But then I guess it's about thinking, how would I deal with that kind of a left field topic?
Those skills of dealing with difficult, I mean, even if you're asking somebody how heart disease impacted their life, like to be prepared for how you handle difficult things that come up in people's difficult emotions.
Absolutely.
I feel like that should be part of the skill set.
Yeah, but then, and I know we've had these discussions where Joanne and I are part of a qualitative community of practice speech therapists around the world, and we've had a lot of discussions over the last months around how do you get students to a point where they're actually able to engage in a very deep, reflective way with this kind of work. And it's really not easy. And it's not easy for those of us who are experienced when that happens. And you suddenly think, oh gosh, what do I do? How do I respond to this person that's sitting in front of me? Yeah. So they also talk about the problem of formal ethics review. And sitting on a non-medical ethics committee, where most of the research that we deal with is this kind of qualitative social science work. We see a lot of projects where sometimes people have thought very carefully about what might happen. Sometimes they've gone completely overboard on a very innocuous project, and then we have distress protocols and referrals where it's really not necessary. And then other times where they haven't given any thought or any consideration to what might happen. So it's always a mixed bag. But the issue with ethics review is that it's asking researchers to say what they will do when you can't always predict. It's not a quantitative study that's really highly controlled.
But even in quantitative, I mean, I had this issue with my PhD on autism, like where it's, you might, even though you're collecting quantitative data, you're collecting it with, vulnerable participants, and you never know what might come up or what you
absolutely. Yeah, so I guess it's the nature of research, that research is not necessarily as controlled as we might think it is in our heads. Yeah.
Do you make critical reflection a big point in the ethics review committee, like in terms of the students, especially doing this type of qualitative work? Because I think that in itself is a skill, but it's such an awareness that is necessary during these studies where you don't know what's going to happen, and kind of getting the student to always anticipate and kind of continuously reflecting on their practice, what's happening in the interviews, who are the participants.
So we try to some extent in terms of the way that the form is structured. Have you thought about risks? Have you thought about this, that, and the next thing? But often they don't have that concept to begin with.
I wonder if it's like something that you need to encourage, like throughout the research process, that it's not just upfront at the review, but that you almost have to remind them that they're constantly, as the researcher or as the student, they are as responsible for ethics as the ethics committee, and they need to kind of take responsibility throughout that project.
That's not really a message that I got throughout my undergrad. You learn theory, you don't learn how to actually do research. You learn like theoretical frameworks and you learn concepts and facts.
Yes,
You
yeah.
don't
And like what
learn
is rigor and what is
Yes.
transparency?
Like as a definition.
Yes,
Not
but
like
not in practice.
yeah, what does this look like in practice and how do you actually do that? Like we don't learn those skills. Like when I got to the ethics review process, it's just a box ticking exercise. And somebody says risks and benefits and you go, what does that even mean? Like the risk is that they might get upset. It's such an abstract concept. It's just a thing to write down. It's not like, oh, how am I going to deal with that in the moment?
In those reports, I mean, I know depends on the ethics committee and how strict they are in terms of those annual reports that you have, those progress reports that you have to keep submitting, and whether they actually read them or not.
I read them. I know on them.
And whether whether all the students remember to submit reports.
No, they don't. It's a problem.
I wonder if that's something that I suppose part of that exercise is kind of reflecting on the project and what are some of the barriers that you didn't expect and what are some of the unexpected challenges that came about.
Absolutely. So one of the things that they are moving towards at WITS is to start with mandatory courses for all postgrads that include a component around academic integrity, but also this notion of why do we do research, research for good, and bringing in ethics in that way in terms of why is it actually so important to think about these things. And, it's not just that we're some nasty committee making your life horrible, but actually there's a purpose behind it. And then to lead into more specific training for if you're doing, for example, a non-medical application, how do you fill in the form? What are the things to think about? But even then, some of the training programs online are more sensitive to some of these issues than others. Others are quite bland. They don't, I won't name the one that's very popular at WITS, but it's very bland. Whereas some of the other courses that we've recommended are far more sensitive to these kinds of issues and working in the field. And
then I find a lot of people just see those courses as again a box tick.
Absolutely, not really engaging.
Yeah, have you completed this? Yes, I can do my project now.
Exactly. Yeah.
Have you actually thought about it?
Yeah.
I think until you've actually engaged with these issues, it will always remain abstract. So it's only once you've been in the field,
absolutely,
clinical work or research, and things haven't gone according to plan. Because I don't think you can really teach this. I don't think you can teach someone to critically reflect because they don't know what they're reflecting on. But I think a lot of the times that, or a lot of the reason that we struggle with these things is because you can't get away from having a preconceived idea of what you're going to find. So, for example, if you're asking what is your experience of raising a child with autism or cerebral palsy or whatever, and they start talking about the sexual abuse of the child, that is still part of that experience, but we wanting them to talk about something we've got in our mind.
Absolutely,
So I think that's why we say to students, you must ask broad, open-ended questions. But the broader they are, the broader the responses is going to be. And I think that's what you need to be prepared for.
You have a flexible interview guide. How flexible,
exactly.
Yes, and can a student cope with flexibility like that, or do they rather need to start off with some kind of rigidity? So all these questions.
You're talking about experience. I think it's like in undergrad, a lot of it is very theoretical. It's very academic. Like write an exam about these theories that from so and so we lived in 1870. But like having experience of clinical experience or doing actual research or conducting interviews, however flexible you are, but to start, I think that maybe needs to start earlier. But if I think about my undergrad, and in third year we did a research project, and it was with animals, and there's a lot to reflect on ethically in terms of working with animals, and there was never an opportunity for that kind of discussion or debrief of how did this affect you? What did this mean? Or what does it mean to inject animals with something that makes them sick? Why are you doing this? Why is it important? And I think that that's a missed opportunity to use the experiences of kind of to approach these ethical issues.
Well, that's what Joe and I have been arguing in papers that we've been writing around bringing qualitative methods into the classroom. So using opportunities to actually train students to reflect, to observe, to reflect on what they're observing. But even then, I mean, we had a classic example where a student just went ballistic in response to a very tricky situation.
Really?
Yes, like screaming, shouting, very upset about what she'd seen and couldn't process and make sense of it. And then we had to figure out how to deal with her and this other group of students who were there watching. And yeah, it's not always easy. Yeah. So, but yeah, so the formal ethics review asks researchers to say what they will do, not what will you do when your project's emergent research question transforms or consent and confidentiality take on a less robust character. So, that was really what the article was focusing on, was the consent and confidentiality issues, and how those might change. So I guess the question is really, can we actually predict with any certainty what will happen? And we know the answer is no there. So our foresight is always going to be limited. And I think there's two extremes as well, because you can go completely overboard and imagine all sorts of risks and things that might not actually happen. Or you can underestimate what might happen, or not be able to predict at all. So,
but I guess it's also then about having what is the plan if something goes wrong, because honestly, I think all of the run around trying to get a referral to a counsellor or a psychologist, I've certainly, in all the research I've done, I've never referred anybody because there's been, you've either had to draw in with some of the community or whatever. It really feels like that's often a tick box exercise. And certainly like with, students, and then the only option for them is for free counselling is to say, we'll refer to Int and Jenny. I mean,
is that
really
feasible?
Is it feasible? How long, realistically, there's going to be a waiting list?
Beneficial,
Absolutely,
and sometimes I think a clinical counsellor isn't necessarily the best. I mean, it depends obviously what the distress is, but it's not.
Well, we had this, like one of the participants that we interviewed recently at Barra, where like the thing that she was most stressed about was traveling to and from the hospital. And part of the distress protocol, I mean, she was also struggling emotionally, but then part of the distress protocol is like refer her to like one of the psychologists in the hospital. So then Sister Coletto, who was interviewing with me, suggested that, would you like us to refer you to a psychologist in the hospital? And she like kind of looked, she didn't say anything, but she just like looked a bit uncomfortable. And then I said, but your stress is that you're coming here all the time. So like to refer her to come to the hospital.
Somebody else.
It was like, that's not really a feasible solution for her.
So really it's about thinking sensitively, but also then understanding a community, because if you think like a student going into a community that they don't necessarily know, how are they going to know what's an appropriate resource? And what this article then goes into, which I'll talk about a bit later, is suggestions, and things like having a group of advisors or somebody who can tell you what might be feasible.
Sorry, just still along that line of thought, but I think a lot of the time, certainly the types of research that we all do, people have had access to counsellors or have made use of counsellors, so it's not necessarily always the best option to say, well, I'm just going to refer you back to a counsellor. But what is the alternative? And how do you write it into your ethics application form? I'm just going to find somebody in the community that's like where there's a good connection or whatever.
And I'm just thinking of Sonto's study where one of the recommendations or one of the programs in Zim that they've started is granny benches, where they train up local grannies to actually sit and give psychological support. So, that is a form of support. So you don't necessarily need someone who's like qualified. And also sometimes the need is more for information rather than counseling or for money. Maybe she needs money to actually help her get here.
What she was stressed about was how people at work were reacting to her taking time off every like she said, initially people were understanding, but it's now 6 months down the line and she's still taking her mother to the clinic every couple of weeks. And people at work are now like,
is this really true?
Like they're getting very irritated about it. sniping at her and stuff.
Yeah.
That's actually what she was struggling with. It's not so much the financial aspect, but the like social aspect at work, which is like, that sounds like an HR issue at work, right?
And how do you
We
solve
can't
that?
do anything about that as the researchers at the hospital. Like, we can't go to her work, march into her workplace and like
say, actually, yeah. So I guess what we need is agility, flexibility.
And then if you
Yeah.
think about like one of Lavagna's participants
Yes.
said her main priority is to make sure she's always got money for data, because she relies on ChatGPT for everything. So when she's feeling stressed, she'll ask ChatGPT what she must do, how to deal with her stress. And
Yeah.
so I mean, I think like the world has evolved, so like the
Absolutely.
solutions need to evolve as well.
Yeah.
Also, there was the one, I think it was the same mum who asked ChatGPT what to do about a peg tube that had dislodged. I mean,
A feeding tube for a child. Yeah.
but she seemed to trust that more than what she trusted the information or the stress of getting to the hospital and the financial
And phoning the doctor,
yeah.
the nurse who only get back to you in like 3 days.
Yeah.
Exactly.
Yeah.
Yeah. So kind of keeping up with what's relevant and what's helpful to people. I guess that's the issue, is what would be helpful. So yeah, it requires agility, flexibility, dealing with uncertainty, which always seems to pop up in our research, and unforeseen consequences. Difficult to predict. So researcher responsibilities are really about recognizing and addressing when there's a big ethical moment. So something that happens in the research that's completely unexpected or left field. And then thinking about when participants are at risk and when or to whom to refer, which we've just been talking about. And then also when the researcher is at risk, because I think that often is a problem.
like that student
Yes.
psychologically like affected.
Yeah, exactly. Yeah. So Sergio, I see you've popped something into the chat here. What would you do in the scenario that was painted in the first article, the daughter who's been sexually abused? I mean, what would we do?
I would approach that with the counseling, like with counseling tools. Like,
but you've got those tools.
Yes. But like that would be immediately, I'd be like, okay, this is what she needs to talk about. Like immediately I'd be like, okay, this needs to be discussed, and how she's feeling and what avenues are available to her about what she can do about it. And, that would be, if that comes up and it's the most important thing, that's the thing. That's the thing you want to talk about. It's like a big stone in the middle of the road and you want to get around. No, we must talk about something else. Like, you're not going to get there.
So you've got to address that it doesn't work just to say, well, we're not talking about that today. Sorry. But I guess what's also tricky from an ethics point of view is then there's an obligation to report these kinds of matters. And then to whom and how do you do that? And
then do you break your participants' trust?
Yes, and the confidentiality.
I think to discuss with the participant.
Yeah.
Like that would be to say, I mean, I don't know what the obligations are as a research. Like, I know as a counselor, when you enter into a counseling space, it's something that you say from the beginning is that, like if there is harm, if there's harm to you or somebody else, it needs to be reported. Otherwise, everything's confidential. But that's when confidentiality is broken. So that would be part of the discussion, I think, with the participant. Is like, this probably needs to be reported, but not to immediately take it out of the participant's hands. I think, like to give them a say.
No, actually, just going to the consent form, to information sheet in the consent form. I'm thinking, especially if you're talking like medium and high risk studies,
that there might be an
Because
obligation
there's
to refer. Yeah.
And I think obviously you guys have been trained as counsellors. We're not specifically trained as counsellors, but we get a fair amount of practice. But I always feel uncomfortable when I'm reviewing applications that come from like social sciences or whatever, where they do medium to high risk studies. Like I had one earlier this year with a student who was wanting to go and interview drug addicts and their families, and she'd had no previous experience with research.
It was like a master's student.
It was a master's by coursework. So I mean, she's done the coursework, and now she's going to go and do this kind of hectic study without any research experience and without any counselling experience. I think it's hard to.
The nature of the discussions are going to bring up.
Yeah, I mean, you have to look at the researcher's positionality as well when you thinking about risk.
Yeah,
because when you've got a psychologist who's doing a study, they're better prepared to deal with the uncertainty that comes up in qualitative thing.
I think you also have to make a call as to, you obviously have to address that you can't, like, they've disclosed something that is obviously worrying, and then you can't ignore it. Like you say, you can't get around the stone, you have to deal with the stone. But I think you also need to sort of gauge whether they want to carry on with the interview now or not.
Absolutely,
Yeah. Say, okay, well, coming back,
Mm.
you know, or we'll refer you, but I actually wanted to carry on. So you've addressed it, you've acknowledged it, you haven't ignored it. But then I think you definitely have to ask the participant, are they okay to carry on? And if not, then I think you need to then stop the interview or make a call as to whether to include that participant in your study or not.
I think this is one of the
Absolutely.
really difficult ethical things is like this, when the interests of the research clash with the interests of the participant. And like kind of weighing up. And I think ethically, most of the time, the interests of the participant need to come first. If that means you have to, this person is no longer included as a participant, and you know you have to find another participant. I think that's appropriate. Like, so not, but it's like what needs to happen.
Just responding to Sergio's point here about the reporting part. So there was a lot of back and forth with the new NHREC guidelines on ethics around this point of reporting. And basically the consensus was you need to weigh up the need to protect confidentiality and preserve minimize risks for the participant versus the obligation to report. So that's really what you've got to weigh up as a researcher. You can't go in saying, well, I have to report this.
Yes.
And then this poor person is now put at risk and, things happen as a consequence. Absolutely. Yeah. So those are the kinds of things that need to be grappled with, and it's not clear cut. So sometimes there might be, moments where it's better to put aside the legal obligation to report in favor of protecting the participant.
That happens, like, I mean, I know it's not exactly research, but I see that a lot at Rahima, like with like these complicated cases. Like I'm thinking about one where a woman came in and she's on drugs and she's brought a young child, and the social worker's responsibility, legally is like to report the mother. But this mother is also known to be the partner of like a gang leader in the area. And then there's like fear also for like what's going to happen to the mother, what's going to happen to the mother, what's also going to happen to the doctors in the clinic who reported. And like where I think the ethics frameworks or the guidelines really fall short in practice, like in the environment. Like there are all these other things that happen and you're like, okay, I don't know what's the best thing to do here,
So in a context like ours where, and I don't think anywhere you're totally guaranteed of protection, but in South Africa, you're more likely to be taken out than
exactly
resolving the.
Yeah, which is why, and Sergio's put in the chat, you need training, and that's so important. I think it's also about supervisory oversight, but also if it's your own staff project, having a team or having advisors or people you can ask to assist with these kinds of conundrums. Yeah, absolutely.
You almost, maybe that's something that's in ethics, that should be in the ethics protocols, is that if, for example, we've got students that wanted to do the interviews on the drug addicts, then having no research experience and no, if they feel strongly that it is a project that they want to participate in, they definitely need to have the support framework around them to say, okay, well then, does your supervisor have experience in this area, or does your do you have, the space to go to if you encounter challenges in terms of other academic peers, or other counselling peers or colleagues?
I think that's also where it's tricky though, because it's also linked to the context. So I'm thinking about this specific project. The student came from this community, so she was familiar with the community and she knows everybody, whatever, small community. But the supervisor wouldn't, because it was in a different province, and even if you've got experience with medium high risk studies,
You don't
Yeah.
The context.
Yeah, so it needs, you need, like you say, it definitely takes like a multidisciplinary
It does.
and perhaps more than one person to be involved in this.
Absolutely.
In terms of mentors or experts that you can lean on if you get stuck.
Absolutely.
Maybe that's something to think about building into the ethics form, about where will you get support and debrief and everything.
As the researcher.
As the researcher, because sometimes it is sufficient to just say the supervisor.
Yeah.
But
understanding the topic and the level of risk involved. You know, because like you said, the risk is often we focus on the risk of the participant, but if we think about the risk of the researcher and whether they're able to handle that type of project.
Yeah, so that's why on our forms we ask about risks, and risks covers participants and researchers. And then right at the end we ask, have you got any experience with using these methods? And every so often there'll be like a master's coursework or an honors level student who's doing a medium risk study. No, I've never done this before. And then we'll say, you know, this is risky. You need to reconsider. You need to tell us what kind of mechanisms you're going to have in place to help you.
Because like you say, some projects you'll just say no to because the risk is too great. But I think if the student can justify how they're going to sort of, I suppose have those fallbacks or those.
Absolutely, then that makes us feel happier. So you know what it's really about, and Gilliman and Gillam talk about is this procedural ethics, so filling in the form, versus the ethics in practice, or the microethics of engaging with these kinds of moments during the research process. And so then they go into a lot of discussion around strengths and weaknesses of qualitative research ethics. So thinking about how instruments can change, research questions can change, the ethical landscape can change. And also that consent and confidentiality are very fragile and can actually change completely and unexpectedly. But what is non-negotiable is the obligation to protect participants and yourself. So I guess that's really the principle to think about in any of these scenarios is, what can I do, or what should I do to protect participants and protect myself? And then they go on to another slightly different topic around the limits of anonymity and confidentiality, which was quite interesting. So the fact that qualitative research can never be completely anonymous. I think the only place where it might be, to some extent, is with a qualitative online anonymous survey. But typically, if you're doing interviews, ethnography, focus groups, you know who the people are. And also that anonymity and confidentiality are often conflated or used interchangeably. So you can't really separate out what the person's saying from who they are and their identity. And I know that that's an issue that we struggle with, even with ethics forms and things, because you know, it's very difficult to, and a lot of people struggle with these kinds of topics.
And it's like, you can't, you know, all the demographic information that you've collected is now relevant to that picture.
It really adds to understanding the context.
How old are they? You know?
And especially if you've only got like, you know, 6 participants or something, then it makes it really tricky.
Yeah. And I think just thinking about, so we had Johanni's project where she was looking at recorded emergency calls, and she had de-identified and taken out a lot of information. And even after that process, one of the examiners still came back and said, there's still identifiable information in here. So there's kind of layers of de-identification, I guess. And what they say about knowing what might make someone identifiable in a quote may be less obvious. So I'm thinking even there was a study that was done in our speech department years ago with a master's student who interviewed a very small group of therapists who had specific training in working with cerebral palsy, who worked at special needs schools for cerebral palsy. And so they were anonymized. But because it's a very small, yes, everybody knows.
Like what you were saying,
Yeah,
We're doing that genetic counseling focus group. It's like such a tiny community. Everybody knows you.
It's tiny,
yes,
especially
yeah,
like if there's only, like say there's only 2 males, and you know exactly who the 2 males are, because there are only
absolutely.
2 male genetic counselors in the country.
You're going to say
You
that,
you
yeah,
can't say, oh, he said this. You have to say the genetic counselor said this, and then it seems like
absolutely.
it's not. Yeah, it takes away the context and that.
It does,
Right.
yeah. And also the particular turn of phrase or opinion. So I remember years ago, Claire Penn, who was our mentor, she wrote a piece anonymously for a newspaper on a day in the life of a professor. And a whole lot of her friends came and they said, "We know it's you, Claire,"
Yeah, of course.
because they could tell immediately from the tone of voice and the
Mhm.
way in which
The
she'd
writing
conveyed
style,
things.
yeah.
Yeah. So
I was
yeah.
asked to mark a psychology honours project, not my master's, sorry, I mean, it doesn't matter, a couple of years ago, and I just saw the topic. I thought, oh, the topic looks interesting, and obviously small sample size. I think they only had 3 participants, but when I started getting into it, I got so uncomfortable because I immediately knew who the one participant was, and she's a good friend of mine, but I didn't know that she'd taken part in the research. There was a lot of the stuff I knew already, but there was a lot of like real
Sure.
like detailed quotes about her experience, and I wasn't sure what to do. So in the end, I had to say to her, I said, "I'm marking this. I just want to let you know because
That's what I would probably do. Like I was wondering, like because like there's kind of I feel like the idea with the confidentiality is like you just like pretend you don't know, right? Like you just but actually if it was my friend, I'd probably be like, okay, I know these things about you. I want you to know because it's
there was it was like weird to have read it
Very
in like
bizarre.
an anonymized format, but you actually it's so identifiable.
yeah.
Yeah. And so what they talked about here was the confidentiality iceberg, which I thought was so interesting, on exactly that kind of point, that you can have external confidentiality where the researcher says, well, I've kept everything confidential. And then there's internal confidentiality, but also this principle of deductive disclosure. So you can work out, as you did, Joanne, that, this is someone I know, and I know exactly who it is based on what they're saying or how they've phrased it. And they give this wonderful example here. It's quite frightening though, in a way. They talk about somebody who published a book on a small town. And many townspeople were highly disturbed to see some of the most intimate details of their lives recorded in print. Even though the author had attempted to protect the informants with pseudonyms, their true identities were easily recognizable to anyone familiar in the area. 15 years later, another anthropologist visited the town and found in the local library a copy of the book where someone had gone and written in the names of all the people next to the pseudonyms. Even after all those years, some of the community members were still visibly upset about the ways in which they'd been portrayed. So, yeah, I guess that's the kind of thing one doesn't necessarily think through.
I often think of that sort of insider outsider perspective. I suppose coming back to your participant interviewing the drug addicts, but like it's in one way for someone having no reference to the context is problematic. Because well, they don't understand the people, they don't understand anticipating the risks, etc. But if you are an integral part of that community and you're now interviewing people within that community, that's also problematic because you have to not only around biases and that, but also now the participants beyond just for the research purposes. They might be friends or colleagues or how and also how do they get portrayed in the research and how do they think about being interviewed about something by another colleague.
Yeah, I'm thinking of Harriet's research on organ transplant, which was so hectic in terms of confidentiality because she had quotes of nurses saying, or doctors or people saying, there were people in the operating theatre who were shouting vultures, vultures across the operating table. Like really, really intense feelings and emotions that came out. And we had to work so hard to try and anonymize as best we could. We couldn't even say doctor or nurse.
Yeah, and if colleagues talking about other colleagues.
It was really, really difficult. And eventually we actually stopped a part of that research with patients and families because things just got so heated. And she actually, we said, no, just don't do any more because it's too much. It's too much and it's too contentious. Yeah.
But I think, you know, certainly when you're filling out the ethics forms, when it asks about anonymity and confidentiality, you're really thinking about just your participants, but you're not thinking about the context
No.
being anonymized. And
yeah.
I mean, I think increasingly I've become aware of how problematic that is. And even going back to Lavagna's research, most of the findings paint a good picture, but not all of it.
No.
But the context is so identified. You can't not. I mean, you maybe don't name the hospital, but anybody who knows.
Oh, they'd figure it out.
I mean,
yes.
There's also a responsibility for it. You know, like to kind of, isn't there? I don't know. I feel like there's a responsibility to like bring up the ways in which certain contexts are like having difficulties because then they can be addressed. Isn't that the point of research as well?
It's such a tricky line. It really is. I mean, one of the questions we've just added to the ethics form is, are you intending to name the institution? Because yes, if it's an institution that's functioning well and you want to highlight how well they're doing, that's great. But if things are going badly, they can.
In healthcare, like
Yeah, I mean, you think of some of these like Tim de Meyer and some of those cases where he spoke up as a representative of that institution, and where did it get him? It got him fired initially and suspended.
But like, in many ways, like I mean, I have admiration for him because he like brought up that need to be addressed at the hospital, like ways in which, the hospital staff are being failed by the system as well. The hospital staff are not able to do their jobs well.
Yeah, it's so tricky.
I used his example in the lectures I've just done with the third years, and I found a report published in July that showed that still basically nothing has been done, even though they gave time frames and whatever. He wrote a follow up on. So tricky to.
It's crazy, yeah. It's
know
just
what the.
And what's the correct response? And I guess again it comes back to that maxim of your chief concern should be protecting participants and protecting yourself. So if there's a possibility that perhaps they're not going to be protected if you publish the name of the organization, then that needs to be considered in terms of what are the repercussions then of naming. Yeah, it's very, very tricky. So I guess it's about realizing that anonymity and confidentiality are not equal. Confidentiality is limits, and then being very, very clear with participants as far as you can, but also then seeing consent as a process. So going back and having discussions around what you can offer or how the research has changed and how this might impact them.
Yeah, like how, with the example of Sonia at the beginning, who, maybe wasn't anticipating what would come up when she consented to her information being used.
Absolutely.
Change her mind and say, I actually don't want you to use this research because of what we've now discussed.
Yeah, and I guess that's what we talked about, Megan, in your article, and the very tricky video data from that genetic counseling clinic was,
pre and
post consent. So, are you still happy for us to use that? But then with that comes what they talk about, this kind of heart sink feeling, and the potential for harm to participants, but also the potential to lose the data, as you were saying earlier, Siobhan. You need this data.
There are not a lot of participants, and it's kind of, you've worked so hard to find participants, and then you have to let them go.
Yeah, I mean, it's the same, I guess, even at the beginning. I remember with my own PhD work that there were some patients who were quite happy to consent to being videoed in their interaction with a pharmacist, and others you could see were just not convinced and then in those instances I actually had to say, look, I think let's leave it.
Yeah,
I could see you're not sure, and yeah, that kind of like, oh gosh, I'm losing data here. I need data, but I have to protect them.
I spoke before about that young man, like who I interviewed, his mother, his mother who's in palliative care for cervical cancer, and we wanted to do follow-up interviews with him and his family, and the mother has now died, and so I mean, from a research perspective, like the research question is around caregiver needs, right? From a research perspective, somebody who's actually experienced the death of the loved one would have a really useful and valuable insight, right? But then it's the thing of like emotionally, they're grieving, like, is it something?
Are you causing harm?
Yes, exactly. So,
Or is it an opportunity for them to talk to, in a way that they wouldn't to other family members? It's because it could be a positive.
You have to frame it that way, and kind of you need to gauge the participant and how they feel, because like it might very well be an opportunity to.
So I think like what I'm giving it time. I'm going to wait till the new year because I think, I think it's like in their traditions, it's like a 3-month grieving process. I think that's what Sister Qualitative was telling me. So we'll wait until the new year, and then I'll contact him and then like see if he's open to it. Take it from there.
So I guess it's those kind of sensitivities as well that one needs to take into account, not like, hello, I'm here to do further research.
But I think it's also about having that, where to draw the line about having a relationship with your participants, because they can't feel like you just coming and taking all their information, and it's not a two-way relationship, but it's sometimes hard to draw that line and to have that boundary. I mean, certainly if they know you've got a psychology background or,
it's very hard. At what point does one draw the line and perhaps step back yourself as researcher? And then at what points do you also step in and say, maybe the benefits outweigh the risks? I guess that's always what you're constantly doing is the benefits outweigh risks.
I've thought about even contacting him before, like just because it's weird that like we had this conversation and I know that his mother's died and I feel a bit strange about the fact that I haven't acknowledged that. But I also don't know like whether it's my place. It's like this line between like, it kind of also
feels a bit intrusive.
I mean, I suppose it depends on how you had contact with them initially, but if you've got a number or something, you could just send a message of
condolence.
I mean, I think that would be appreciated no matter how far down the line.
And you can keep us hungry, because like you say, you're acknowledging it, but you're not sort of
not saying condolences and would you like to have another meeting?
On the phone you tomorrow.
But to then follow up in the new year with like asking.
Very tricky to navigate these things. I liked what they said about qualitative research can't be undone. So nothing this researcher could do could make the known unknown. It was too late to put the genie back in the bottle. So, sometimes we kind of unleash things and let that genie out, and then we don't know what to do with it and how to actually manage the scenario, and that's very, very tricky.
I think especially in our context, sometimes people have so few opportunities or avenues for support that like a researcher, like they're not necessarily like, okay, I'm engaging in research with a full concept of what research is.
Exactly.
But here's a person in front of me and they want to ask how I'm doing, and then now all this stuff.
And they nice.
And they just, it's kind of like taking the opportunity to get support where it's presented.
Absolutely. And we've certainly seen that even with things like focus groups in hospitals, where at the end often people will say, can we do this next week? Because it's more of a support group, and as you say, it's a scrap of support, and it's more than what they're actually getting. But also then realizing, I remember Claire always used to tell us, qualitative research and sharing your story is not necessarily cathartic. So for some people, it's actually detrimental and traumatic. And I guess it's about being sensitive and tuning into when it's okay for that person to share and when it's not okay.
People also tell you that though, like people, when people are very reticent or like they're not very forthcoming, people will indicate to you how much they're willing to share. I think there's a sensitivity, maybe it's a skill, but there's sensitivity and probing of like
what like reading those nonverbals and
and what people bring as opposed to like, what you might be interested in. And I think that's also the thing about talking about the sexual abuse. example. It's like, this is what she's bringing, so this is what we talk about.
Mm.
You know?
But having the skills to actually manage that in the first place. So, you know, having some basic counseling skills or something would be necessary, I think, to handle that.
Yeah, I was just going to say, I think sometimes when those things do just get like put out there, like right, often quite near the beginning of an interview or at the end of the interview, it's because you're a neutral person to be speaking to. You know, you're not, you know, you're not a family friend or a, you know, biases either way between the husband and the wife or whoever the parties might be. I think, and I think it links to that, developing that rapport where they feel safe that they can talk, but then having somebody who is either neutral, seems like they're knowledgeable or know what to do. Or, I mean, because that example in the beginning, it's almost like she's saying, and now like, what must I?
Yes.
What must I do? I
He needs help. Yeah. So what is helpful in that instance? Yeah. And what do you do when you don't actually know how to refer them or yeah. So I mean, I think that's why it's so important to follow some of these points that they had suggested around a reference group. So having people around you who you can consult. If you know, and this is the scary thing I think with ethics is sometimes you see these projects and you can just see that the supervisor is very hands off. And that is scary because then you know that the student doesn't really necessarily have that support mechanism. Yeah. And member checking. So when one can actually going back and checking, although from experience, I've found that people actually don't want to go through that process. They find it irritating or they don't have time to sit and go through their transcript again. You know, it's like, well, I've given you my story, so leave me alone. Yeah. So, but where one can, and I think perhaps where it's a sensitive topic, one can maybe go back and do that.
So it depends, not necessarily for the participants, but sometimes like the research setting wants feedback. The seniors or the clinic heads or
absolutely
some sort of like report or presentation.
Yeah.
I got asked, I remember from my project, like the hospital groups wanted feedback from what the findings were.
Yeah, and that's also tricky sometimes to report back. Like I'm thinking of Lavanya's project, you know, if one of those departments in particular asked for feedback, it would be tricky, you know, because some of the aspects might not be easy to convey in a way that's well received or that protects participants. You know, again, if it's bad practice and then you're reporting to a manager who wants to know what's happening.
Yeah. And also, I suppose that's also those ethical obligations, like you're obliged to report back. What are the consequences if you do report back?
And again, I guess coming back to that maxim of your job is primarily to protect participants.
So if you can, I suppose if you can structure the feedback in such a way that you're saying these are kind of recommendations for what you as the department management need to do, not this person is bad and they must be fired, but like, you know, there are certain practices that people need more training in.
Aggregate.
You're not singling people.
Absolutely, yeah. And then one of the other things they talked about, sorry, Jo. Yes.
Just before you move on from that, I think that can also be quite tricky where sites want feedback because it depends on what format they want. And I'm just thinking, I mean, there's that one private school in Joburg where, so if once you've got your provisional clearance and you've got to fill out this form and they insist that you hand over all raw data. So all audio recordings and transcripts. So I mean, I've had two students who've approached this, well, the one, and then one came through ethics, that was how I became aware of it, and I've got another PhD student who wanted to approach the school. So I'll sign another. Because it could reflect badly on some staff. They could, if they don't like your data, they can shut down.
What are they doing with that data?
Yeah, exactly. Afterwards,
and the same kind of thing we occasionally get through ethics, where permission letters will say yes, they give permission, but they insist on approving the thesis before it's submitted, and that's what we've said as well. Like run far away, run.
But and those are difficult because often it's somebody who's working in that institution who's doing a master's or PhD, and they say, yeah, sure, because they can see the benefit of it. But if the data isn't positive,
They don't like it. Exactly. Yeah. So they do make this principle of caveat emptor as well, which is basically participant beware. So in some instances, they're saying you actually need to tell your participants, like, I can't guarantee confidentiality. I can't, so that they know going into something what is and what isn't on the table and what might be
I
involved.
recently
It's
had a
tricky.
participant also choose not to participate after, like, we were having the consent in discussion and I was taking him through the consent form. And then, and then he was like, and then when I was like, and he was like, okay, that's all fine. And then I was like, okay, so would you sign this? And he was like, I don't want to do this. And I was like, and then I said to him, I'm not, that's perfectly fine, but would you mind telling me why? And he said, I don't really want to talk about it. I don't want to talk about what's going on.
Yeah.
Okay.
You see, often I think there's also a historical suspicion and experiences of exploitation with research. So there is a mistrust as well from the start. But maybe he just suddenly realized, like, whoa, I'm getting in too deep and I can't.
I think he felt emotionally overwhelmed.
I
think that
just couldn't do it. Yeah, absolutely.
I'm sure, especially in the type of research that you do, because a lot of those, certainly in the caregivers, it's almost like being a hamster on a wheel. You've just got to get from one day to the next and keep up with the appointments and make sure that the person's comfortable and whatever. And take a step back and reflect on everything that's going on. Not everybody's in a
But that's
space.
why the family of the woman who has died could be really interesting because they're no longer on that hamster wheel.
Yeah.
So they're looking back on the experience, Yeah.
I guess one just has to handle it and approach it sensitively, and very tricky. So they talk about this process consent, which does have the risk of potentially losing the data, and one has to then bear that risk. And that is tricky, as you say, Siobhan, where you've got like a case that's so interesting and so could potentially help tremendously with insights into how to support in that kind of scenario. But it's this gamble of, will they say yes or no, I guess.
Even worse when your degree is dependent.
And there's pressure these days. It's harder and harder to find participants. I know of lots of students who've struggled tremendously with that. So I guess it's about thinking ahead. So working within a paradox of foreseeing the unpredictable, and it's not really possible. Thinking about things like risk categories and distress protocols, but also don't over imagine potential risks and harms. So, and I come back to the point that some of our psychology colleagues made, and I sent you, Siobhan, some of those readings, that distress is not necessarily a bad thing. So psychological distress can actually be healthy. Like someone crying in an interview can be healthy and is not necessarily a bad thing. And
it's not necessarily distress. And I suppose that's what to recognize what is distress
and what is
because
not.
Crying isn't necessarily distress, and not crying doesn't mean that they're not distressed.
Exactly. And I'm thinking of like one of Cynthia's interviews with a mom in a township looking after children with CP, with cerebral palsy, and was crying in the interview. And then when she offered her a follow-up for a psychologist, no, I'm fine. Like just needed to get it out in that moment. No, I'm fine.
It's almost like torture counseling to like allow those silences.
Absolutely.
Not necessarily a bad thing. And it's often your discomfort with the crying that you like cry, like when you don't cry, like
this is part of the plan.
It just kind of holds the space and let them be and kind of gauge,
absolutely,
whether it's something that is distressing or whether it's actually like a cathartic process.
Absolutely.
I mean, I've had experiences of people, crying, getting upset in an interview because they're like reckoning with what they're actually struggling with, and by the end of the conversation, they like have things to do, like they've like kind of figured out, okay, like this is an issue, I need to do something about this. This is an issue, and I need to do something about that. And that they've actually found solutions to the problems that they weren't acknowledging before. That process of crying or distress actually brings them into contact with what needs kind of adjustment.
I think what you were saying, Siobhan, about how sometimes the research interview or the research space can be a psychologically safe space and offer some meager support that they're not getting elsewhere.
Yeah.
And that's not to just kind of say, well, you know, research is now cathartic and we can do what we like, but to recognize that for some people, that's actually a helpful space. Yeah. But also thinking about psychological safety all the time for yourself as a researcher. And really about expecting the unexpected. So recognizing that, and even the most mundane projects often end up with, so I guess that one about heart disease started off quite mundane and then ends up with this hectic stuff coming out.
Yeah. You certainly don't go into researching heart disease thinking I'm going to talk about sexual abuse.
Absolutely not. No.
Wouldn't have been like, oh yes, one of the risks is that people talk about sexual abuse.
No. So, you know, yeah, I guess expect unexpected things to happen in any social science project.
I saw this last night on Instagram, and it's so funny that you've like ended this as your take-home message, because it's a quote by someone, and he says, "My entire life changed when I realized that preparation always means planning. Planning is based around the expectation of order. Preparation is based on the expectation of chaos. Plan for order and you'll be destroyed by chaos. Prepare for chaos and you'll thrive in any condition."
That's very interesting. Yeah. So, and kind of moving away, I guess, from the type A personalities that some of us have of wanting to control.
Expect the unexpected and sort of know that things, may happen that you haven't anticipated. Or
absolutely, yeah. So I don't know if there are any last thoughts from anybody online. Thanks, Sergio. I saw your comment. But yeah, it's been a good session. So thanks, everybody. I think we could talk about this for hours. Yeah. So thank you. And
I think I've got a simple solution. We'll just do scoping reviews.
No. After the scoping review,